One.
All right, Coach Lake here, and we are talking about pregnancy and childbirth. All right, as you learned in lesson 2, when an egg cell and sperm join, the egg becomes fertilized. This begins the process called pregnancy or gestation. Gestation lasts about 9 months. This is the period of time needed to allow the fertilized egg to grow and develop. So first question, how does a woman know she is pregnant? There are several signs of pregnancy. A woman may feel sick or very tired. 2, she probably has missed a menstrual cycle since menstruation stops during pregnancy. 3, her breasts may feel sore. If a woman believes she might be pregnant, she should find out for sure. A blood test at a doctor's office can check for pregnancy as early as 10 days after fertilization. A different test can check a woman's urine for a certain hormone that is released during pregnancy. A doctor can determine if a woman is pregnant for sure in 3 ways. Number 1, the doctor can hear the fetal heartbeat. 2, the fetus shows signs of movement. And 3, an ultrasound picture shows a developing baby. There's also at-home kits that a female can use, but those aren't 100% reliable. It is always best to go to a physician to see if one is truly pregnant or not. All right, so if a woman is pregnant, her doctor will give her important information. A pregnant woman needs to take special care of her body. She needs to pay attention to what she eats, drinks, and what medication she is taking. To be honest, this is probably a pain in the butt, or so my wife said. The doctor also will ask the woman to come in for regular checkups during pregnancy. Second question, what happens as the fertilized egg grows? So in the early stages of pregnancy, many things happen quickly. It takes about 4 days for the tiny fertilized egg to travel from the fallopian tube to the uterus. While it travels, its cells divide many times. It becomes a ball of cells that plants itself in the lining of the uterus. This process is called implantation, and this happens in about 6 to 8 days after fertilization, so it's fast. At this time, the fertilized egg becomes an embryo. An embryo is about the size of a dot on like the letter I. If you were typing and then the little dot above the I, that's how big it is. Ish. A special organ called the placenta develops from the embryo along the lining of the uterus. The placenta surrounds the embryo. Now the umbilical cord joins the embryo with the placenta. The cord transports nutrients to the embryo and removes its wastes. So a special fluid protects the embryo in the uterus. The embryo floats in this liquid which protects the embryo against temperature changes and injury. All right, third question. How does the embryo develop? So the 9 months of pregnancy are divided into 3 trimesters. Trimesters are each 3 months long. After 8 weeks, 2 months long. So after 8 weeks or about 2 months, all the vital organs have started to develop. By this time, the embryo is called a fetus. The fetus continues to develop during the rest of the digestion period. At the end of this time, the fetus is considered full term and is ready to be born. What happens during childbirth? Childbirth has 3 stages. The process of birth begins with labor pains that happen when the uterus contracts. These contractions begin to pull the cervix open. The cervix is the narrow outer end of the uterus. The cervix has been closed to hold the growing baby inside the uterus. It must open or dilate to a diameter of about 4 inches. Dilation of the surface of the cervix is the first and usually the longest stage of birth. During this time, the woman feels labor pains that happen more and more often as the contractions continue. Also at this stage, the protective fluids that were surrounding the fetus break and flow out of the woman's body. When the cervix is dilated, the second stage begins. During this stage, the baby is pushed, usually head first, out from the uterus. The baby is then able to breathe on its own. This stage of birth usually takes from 20 to 50 minutes. Like I said, usually. For my wife and I, this process took like stinking forever, like 3 days. But anyway, the third stage is called the afterbirth. At this time, the uterus contracts to release the placenta, which leaves the woman's body. This stage usually lasts about 1 minute, or at least lasts just a few minutes. So, last question. How does the body adjust after childbirth? No, I'm joking. The new life has begun, and it usually is a happy, exciting time for the new parents. The woman's body must adjust after birth. It may take several months to return to normal. The changes in her body may cause some emotional ups and downs as a result of changing hormone levels. Sometimes women have postpartum depression, which usually lasts a day or two. If it's longer or is severe, a woman may need to ask her doctor for help. All right, so that is lesson 3 on during this unit, and it was on pregnancy and childbirth. I hope you enjoyed it. Remember, take the video or watch the video, take the quiz and exam, and next up we have hereditary and genetics. Coach Lake, peace out.